So moving on to a second case study. So this is a female who asked me to assess her. She's in her 20s. Prior to Gcmaf, she was too ill to work. Her history is she had a sudden onset of ME in 2007, and she was moderately to severely affected, met Canadian consensus criteria. Again, no evidence of elevated distress. And her worst symptoms were the post-exertional malaise, the cognitive dysfunction, disequilibrium, frequent diarrhea, night sweats, pain, particularly joint and muscle pain, non-restorative sleep, had a lot of tingling and numbness in her extremities, and sensitivities to light, sound and to food. She undertook 6 months of Gcmaf treatment with positive effect, but just also to note that within that she took several months of the low dose naltrexone, and within that period there was no improvement noted, so perhaps that's something that we need to bear in mind when patients are trying these interventions. Okay, so prior to Gcmaf she was scoring 89.5, and after she was now big reduction in symptoms down to 36 with a large effect size of 9.3. However, she's still above the normal range and being still quite symptomatic, but much improved from where she was. Her fatigue severity scores normalised from 6.1 down to 3.3. Physical functioning has increased from 50 up to 85, which is in the normal range and a large effect size. And the role limitations due to physical function has gone from 0 up to 100, which is the maximum there, and is actually above the normal range. Energy fatigue is 30, improved to 65, so again, just actually a little above normal. Emotional well-being improved, as a social functioning. Pain has improved to a really good score there, and a perception of her general health has improved, but there's still some way to go there. And the Bell scale scored initially 30 to 40, and is now reporting 70 to 80, so a really big reduction and improvement in quality of life. Neuropsychological testing, this one's particularly the PACE-AP test. This is in auditory information processing, speed and mental flexibility. Prior to Gcmaf she was in the impaired region, and this is one test which is most likely to be impaired in people with ME. And you're expecting for this lady to be in this region here. After Gcmaf, sorry I don't have a graph there, but she's in the 45th percentile, so just here, so just below the 50% level. And that's increased by a change of 1.5, but obviously that's less than we would like, and perhaps she's still quite symptomatic, but clearly a lot better, but there's still perhaps some way to go. So of the other 12 neuropsychological measures, they've improved from very small, sort of irrelevant sort of effect size of 0.1 up to some other changes of 1.5, and 7 measures are within the expected range, the percentile range that we'd expect for her, and the other 6 remain below, so there's still some way to go. This patient, difficulties remain in gross motor control and speed in this auditory information processing, and she also passed all measures of effort in both assessments, pre and post. So her other objective measures, she was, in terms of pedometer and the ability to how many steps she was taking per day, that pretty much doubled from 3,500 up to 7,000, an effect size of 1.4. Her body temperature also increased, and she was able to do the stir test only on day 1, and took her 70 seconds, and she was able to do it after, and 55 seconds and 51 seconds then. She was unable to work before, and now she's able to work 15 to 20 hours a week, so she's able to work part-time, which is a huge improvement for her and her quality of life. Again, I have a diagram of the temperature. The green is the before. Her body temperature is rather erratic, and there seems to be some evidence pointing towards a more normal pattern. And this is an overview which Susan and the group in Chester have allowed me to present to you. What the patients in this patient-led initiative are asking each month when they're trying the Gcmaf to give Susan an idea of how they're getting on. So they're recording themselves using the Bell scale. So they're recording themselves where they're at their worst, where they are at their best, and where they are at their average. So this is one particular patient here, and showing the green pretty much right the way over, showing they were much better. So they've gone on average from most of the time being 30 on that scale to now going over to being 80 on that scale, and staying consistent even after having completed the Gcmaf with. And the red here showing that there was some worsening of symptoms, so some initial reaction to the Gcmaf. We have another patient here who's sort of 4 months in, who's moved up to 60 from 40, so an improvement there, and that's still ongoing. Another patient here moving from 40 to 75, and one here moving from 20, and has been on this for quite some time and is perhaps not going to respond with a movement only up to 30. And some worsening here with this patient moving from sort of 25 to 30, so not really responding. And this will move 30 to 40. Perhaps these are sort of early days really with these patients. Okay, so just to summarise. Okay, so ideally patient assessment wants to include objective and subjective measures that capture both the patient's experience and provide clinicians and patients with as much helpful information as possible to guide ongoing management and treatment. Wants to be of a short duration and informative and meaningful as possible. I think I spend on average about 2 hours with each patient, so try and keep it as short as possible. And what can we really say? Well, really at the moment we've only really got 2 case studies, both of whom are female, and I think it's worth highlighting that Gcmaf here on its own has not been, neither of the case studies would consider themselves to be cured, so there's more to be done, perhaps whether that's working with other medical interventions or perhaps maybe a longer duration of Gcmaf. Of the other patients, 4 are doing well, 5 appear to be sort of staying the same, and 1 is perhaps responding less so. And we need to be cautious really about, we can't, this is very early stage, we can't really conclude much from this. And ideally it would be great to identify subgroups of responders, non-responders. Perhaps we've got more from this workshop this weekend, we've got more of an idea of what that might look like, and other treatment synergies too. Okay, and so finally, for an ideal world, what would be really great to see is to look for placebo-controlled, double-blinded, multi-centre studies that look at obviously the effect of efficacy, but also examine the effects on the immune system and study the mechanisms of increase in functioning in people with ME. Okay, so I shall leave there. Are there any questions?
Did you have males in your study?
You don't get that.
Yeah, it's what it is. It's a patient-led initiative and they're allowing me to assess them. So I'm not leading the study in any way. So it's not my study, so to speak. But yes, in the group of the 10, there are males in there. It's just the 2 that I've asked and the 2 that have asked me to reassess them. They don't mean
also anorectic patients sometimes are males.
I don't understand.
I would like you, if you could tell us about mounting chemical sensitivity. If
Yeah.
you could say some words about that.
This is particularly when the patients are very hypersensitive, quite often but they're pretty much always alcohol intolerant, so even a very small amount of alcohol will make them feel very, very ill. But also sensitivities to things in their environment, so particularly cleaning products, things like petrols, sprays, perfumes, shampoos, and also sometimes some foods. They become hypersensitive to and feel very, very ill, and it exacerbates their not just sort of giving them like an allergy, but actually exacerbates their ME symptoms. And sometimes if they were to come into contact with, say, particular perfumes and things out in the environment, it would take them maybe 3 or 4 days of bed rest to recover from. So it can be something that can sort of happen to them quite unexpectedly, and it can be highly debilitating.